Joining me now is Washington Democratic Congresswoman Kim Schreier. Her district includes King County, which was, of course, an early epicenter of the coronavirus outbreak. She's also a pediatrician and, in fact, the only female medical doctor in Congress. Welcome back to the broadcast, Congresswoman. I'm curious your reaction to what you just heard from the Secretary of Education, both A, not directly answering the questions that she was asked, and B, referring to data that suggest there's no evidence to say that children would not be safe returning to school. Haven't most schools been closed since the pandemic really got underway? All the schools I'm familiar with, they've been closed since about mid-March. So where's that data coming from?
You know, I think those are great questions. My first answer would be directly to Secretary DeVos. You cannot guarantee children's safety in school right now. You cannot guarantee teachers or principals or bus drivers' safety right now. And the data that we have, while I agree with the American Academy of Pediatrics that children as a whole are far better served being in school, the data that we have now comes from countries that have reopened schools, but no country has opened schools when rates are surging. The pattern is you get control of the illness and then you open schools, and you do it in a way with social distancing and masks that protects the students and that protects the teachers.
Absolutely. And I don't think anybody argues that a student learning in a school setting is more effective than that of learning for any number of reasons, you know, online and sitting alone at home in front of a computer screen. But let's take a look right now at some of the new CDC guidelines that the president has criticized, and they include keeping desks 6 feet apart. Okay, adhering to social distancing. No cafeteria lunch. Again, adhering to social distancing, having kids eat on their own, separate. Stagger arrival times, use face coverings. The president is saying that these recommendations are too expensive and too tough. How so, are they?
Well, first of all, those are very reasonable recommendations. But I want to just couch this and say, we just had a hearing in Congress in my committee on Education and Labor where we looked at the state of America's schools, which frankly is horrifying in a lot of high poverty neighborhoods where there aren't windows to open, there's terrible air circulation. You are putting kids in a closed box, and we know that there is airborne spread of this disease. And so I think that the guidelines are great. The rollout practically is difficult. And frankly, we have a bill to get money to states and local governments that would help pay for some of these. We have money going directly to schools, but that bill has not been taken up by the Senate yet. And so we are not even able to get schools the resources they need to open safely.
Well, speaking of the money, as the president is threatening to withhold federal funds from schools if they do not open, the governor of your state, Washington Governor Jay Inslee, is certainly pushing back, and he says he's not going to be bullied into making decisions that are not best for Washington. And he vowed that schools will open in a way that maximizes learning and safety. Do you see the best path forward for doing, though? And I'm curious how much pressure is coming to you and the governor from your constituents.
Well, first of all, I completely agree with my governor. I think he has done a great job guiding our state. We were the first hit with this virus, and we have managed to do a pretty darn good job of keeping things under control. Although I should note that even in Washington, with the best guidance, our rates are increasing. Bullying by the president, I would just put it aside. Look, 90% of funding for our schools is state and local government. 10% comes from the federal government. I would just completely dismiss those threats. What we need to do is look at levels of circulating illness. We need to look at each school district separately. We need to look at the age of the children. Young children, far less likely to have bad symptoms, less likely to get this disease, less likely to spread it to others, including their family and their teachers. Middle and high school students, far more likely to be the ones who spread this amongst themselves and bring it home to their families. And so this is something that should be done based on the science, depending on the circumstances on the ground, and we need to control this disease. I mean, if parents out there are listening, if you want schools to open and open safely, you got to do the work now. You got to stay home, stay away from people, put your mask on, just really do all the things we've known all along you need to do to keep the community safe.
All right, Congresswoman Kim Schreier, I hope a lot of people were listening to that conversation. Thank you so much.